Hello everyone, this is your Master Travel. This is gonna be my first taboo topic, which means the things which must be discussed. And I'm very proud to discuss. The reason is that it's all about the girls, it's all about the women's, it's all about periods. Many boys are not aware about it, and many men, even after marriage, is not aware about it. So in this particular video, you would be knowing detailedly what is periods and what are the types and how this pain occurs and why it occurs, and what to do, what to eat, what you must not eat, and how you can make them relax, and many more. So let's get into this video. And it's all about periods. Periods is a natural thing for a woman. It is a part of their menstrual cycle. The menstrual cycle is a process of preparing the body for pregnancy every month, because only woman can give a birth to a child. So when does this particular periods comes towards a woman? It's all about the age of 9, 10, 11, 12, 13, 14, 15. Any of this particular age, this particular periods would begin just like that. During this time, they would be feeling the changes in hormones, ovaries, and the uterus. These are the important things. And periods are also known as menstruation. And if you ask what would happen internally, the blood and tissue from the lining of uterus comes out of the vagina. It's all about when a woman is getting ready for the pregnant, the baby forms in the uterus. So since a normal woman is not getting pregnant, this particular blood flows, and that's the point is called periods. And this particular periods lasts for a few days and happens once in a month, pregnancy or menopause. And periods are sign of a health and fertility, and they are not nothing to be ashamed of. So you must guide them, okay? So during this time, you must properly have a guide, and it's all about your mother or your friend. It's all about you'd be in a school or college just like that. You must not feel shy to ask. The most important thing is that you must carry a sanitary pad in your bag, because once you get your first period, it happens just like that next month, just like that. So be prepared. And next comes irregular periods. This is the point when your periods are unpredictable or vary in length or flow. You might take a lot of days to get a period. It can be caused by stress, weight changes, exercise habits, hormonal imbalance, polycystic ovary syndrome, thyroid problems, or other medical conditions. So remedies for this are taking oral contraceptives or hormonal injection to regulate your cycle and hormone levels, taking metformin if you have PCOS to improve your insulin sensitivity and ovulation. So what is PCOS would be explained later. Our next step is managing your stress level with relaxation technique, counseling, or medication. And next comes maintaining a healthy weight and eating a balanced diet that includes complex carbohydrates, protein, healthy fats, and fiber. And last, exercising moderately and regularly to improve your blood circulation and hormonal balance. And the final problem is all about the absent periods. This is the point when you miss your period for 3 months or more. It can be caused by pregnancy, breastfeeding, menopause, low body weight, excessive exercise, stress, hormonal imbalance, PCOS, thyroid problems, or other medical conditions. So some remedies are there for even this particular problem. Taking a pregnancy test to rule out pregnancy as a cause of amenorrhea, taking contraceptives or progesterone pills to induce bleeding and restore your cycle if you have low estrogen level. And next comes taking thyroid medication if you have hypothyroidism to regulate your thyroid function and metabolism. And next comes treating any underlying condition that may affect your ovulation or uterus function with medication or surgery. And finally, gaining weight if you're underweight or losing weight if you are overweight to achieve a healthy body mass index. Reducing your exercise intensity if you exercise excessively or increasing your physical activity if you are sedentary to balance your energy expenditure and intake. So when you follow all these things, you might feel better and you would have a regular periods. And here comes PCOS, that is polycystic ovary syndrome. It is a problem with hormones that happens during the reproductive years. If you have PCOS, you may not have periods very often, or you may have periods that last many days. You may also have too much of hormone called androgen in your body. With PCOS, many small sacs of fluid develops along the outer edge of the ovary. These are called cysts. The small fluid-filled cysts contain immature eggs. These are called follicles. The follicle fails to regularly release eggs, and that cause of PCOS is unknown. Earlier diagnosis and treatment along with weight loss may lower the risk of long-term complications such as type 2 diabetes and heart disease. So here are some common symptoms if you have PCOS, that is irregular period or no period at all, difficulty falling pregnant, weight gain, loss of hair or hair thinning, excessive hair growth on face, chest, back, or mood changes, sleep problem, infertility, depression, fatigue. These symptoms may vary from person to person and may start around the time of the first menstrual period or later in life. PCOS is a hormonal disorder that affects the ovaries and can cause problems with ovulation, fertility, metabolism, and appearance. PCOS is also associated with higher risk of developing type 2 diabetes and high blood pressure. If you have any of the symptoms, you should see a healthcare provider for diagnosis and treatment. And there is different treatment options for PCOS depending on the symptoms and the goal for the person. And here is the first one, that is lifestyle changes. Losing weight, eating a healthy diet, and exercising regularly can help improve insulin sensitivity, lower androgen level, regulate periods, and reduce the risk of diabetes and heart disease. A diet that is low in carbohydrates and high in protein and fiber may be beneficial for PCOS. And a registered dietitian can help create a personalized plan. So if you plan this, you can clearly make a change. And next comes hormonal birth control, that is pills, patches, injections, or vaginal rings that contain estrogen and progesterone can help balance hormones, regulates periods, prevents headache. However, hormonal birth control may have side effects such as weight gain, mood changes, blood clots, and headaches. It also does not help with fertility. And next comes metformin. This is a medication that is used to treat type 2 diabetes. It can also help lower insulin, blood sugar levels, restore ovulation, regulate periods, and improve fertility in some women with PCOS 1 to 4. Metformin may cause side effects such as nausea, diarrhea, stomach pain, and vitamin B12. And next comes clomiphene or letrozole. These are medications that stimulate ovulation and increase the chances of getting pregnant. They are usually taken for 5 days at the beginning of each month. They may cause side effects such as hot flashes, mood swings, headaches, ovarian cysts, and multiple births. And next comes spironolactone or eflornithine. These are the medications that can help reduce excess hair growth on the face and body. Spironolactone is a diuretic that blocks on the effects of androgen. If eflornithine is a cream that slows down hair growth, both medication may take several months to show results and need to continue to maintain the effects. It may cause side effects such as low blood pressure, dehydration, electrolyte imbalance, and breast tenderness. Eflornithine may cause side effects such as skin irritation, rash, and aching. And next comes surgery. In some cases, surgery may be an option for women with PCOS who have not responded to other treatment and want to get pregnant. One type of surgery is called laparoscopic ovarian drilling, that is LOD. It involves making small holes in the ovaries with a laser or electric current to destroy some of the tissue that produce androgen. This may lower androgen level and restore ovulation for some women. However, surgery has a risk such as infection, bleeding, scarring, and damage to the ovaries or other organs. Finally, the best treatment for PCOS depends on the individual situation and preference of each person. It is important to consult with a healthcare provider before starting any treatment. A healthcare provider can also monitor the progress and adjust the treatment as needed. And next comes PMS, that is very important, and that is called premenstrual syndrome. This particular thing occurs to a woman when she is going to attain a period. When a period is approaching to the body, before that she will be feeling this particular process, and that's what it is called PMS. It is a condition that affects some women before their menstrual period. PMS can cause physical and emotional symptoms such as mood swings, bloating, breast tenderness, headache, and irritability. The exact cause of PMS is unknown, but it may be related to changes in hormones and brain chemicals. PMS can be managed with lifestyle changes such as reducing salt, caffeine, and stress, and increasing exercise. As pain relievers, birth control pills, or antidepressants may also help with PMS symptoms. So PMS and PMDD are both conditions that affect some women before the menstrual period, but they differ in the severity and impact of their symptoms. PMS stands for premenstrual syndrome, and it is refers to a group of physical and emotional symptoms such as bloating, breast tenderness, or moodiness that tends to be less severe than those of PMDD. And PMDD stands for premenstrual dysphoric disorder, and it is a severe form of PMS that affects fewer people but cause more physical and mental symptoms. So here is the symptoms of PMDD. That is sadness or hopelessness, anxiety or tension, extreme moodiness, depression, or suicidal thought. The exact cause of PMS and PMDD is not clear, but may be related to changes in hormones and brain chemicals. Genetics may also play a role. The diagnosis of PMS and PMD is based on your symptoms and how they affect your daily life. There are different treatments available for PMS and PMDD, such as antidepressants, birth control pills, nutritional supplements, herbal remedies, diet and lifestyle changes, and avoiding stress. If you have symptoms of PMS or PMDD, you should talk to your doctor about testing and treatment options. And here is some yoga asanas that may help relieve period cramps, such as first one, it is Kobla's pose. It is Baddha Konasana. This particular pose opens up the pelvic region and can be done with forward bend using a ball chair or several folded blankets to support your toes. And next comes head to knee pose, that is Janu Sirsasana. This pose stretches the hamstrings and allows you to focus on one leg at a time. And third comes seated straddle, that is Upavistha Konasana. This pose stretches the hamstring and inner thighs while also lengthening the spine. And next comes seated forward bend, that is Paschimottanasana. This pose goes deeper in opening the hamstring and calves and give you back a nice stretch. And next comes supported bridge pose, that is Setu Bandha Sarvaganasana. This pose helps open the chest and stretch the spine. And the last pose, that is goddess's pose. This pose helps to stretch in the lower body and open up the hips. And it is very important to listen to your body and only practice yoga when it feels best for you. If you are new to yoga or have any concern, it is always a good idea to consult with a qualified yoga instructor or healthcare professional so that you would do it in the right way.
And here the part 1 of the video is coming to an end, and part 2 of it you would be seeing on the next week.